Welcome to EMTprep Pulse Check, the podcast where we help you sharpen your knowledge, ace your exams, and stay field ready. Whether you're prepping for the NREMT or looking to stay sharp in the ever-evolving world of EMS, we've got you covered. Each episode brings educational insights, real-world case reviews, and expert tips to boost your confidence, both in the classroom and on the call. Let's jump in.
Today we'll be covering 50 advanced EMT questions covering the following focus areas: medical and OBGYN, cardiology and resuscitation, trauma, EMS operations, and airway and breathing. Let's get started with our questions, brought to you by Jonathan, one of our content creators.
First question. You are called to an apartment building where a 60-year-old man complains of chest pain. You conduct a thorough assessment and sample history. You learn that the chest pain started while the patient was moving large boxes from his bedroom to a moving truck parked outside. The pain subsided about 5 minutes after he sat down, and he described the pain as crushing. This patient is most likely experiencing. Possible answers include angina pectoris, an acute myocardial infarction, dysrhythmia, or congestive heart failure. The correct answer is angina pectoris. There is nothing to suggest that this patient is experiencing congestive heart failure or dysrhythmia. There are three main differences between chest pain due to angina and acute myocardial infarction. First, angina usually occurs following exertion or emotional stress. Second, angina typically lasts between 3 and 8 minutes. Lastly, angina is usually resolved by rest and/or nitroglycerin. Patients with angina will often describe the pain as crushing. Next question. A woman calls 911 because her husband has collapsed in their home, and upon your arrival, you find a man in cardiac arrest. The monitor shows asystole, and you confirm it in multiple leads. Your pharmacological approach is to deliver epinephrine. Which dose and concentration will you use? Possible answers include 1 milligram of 1 to 10,000, 0.1 milligrams per kilogram of 1 to 10,000, 0.1 milligrams per kilogram of 1 to 1,000, or 1 milligram of 1 to 1,000. The correct answer is 1 milligram of 1 to 10,000. For asystole, the dose of epinephrine is 1 milligram of 1 to 10,000 IV or IO. Next question. You are called to a house for a 59-year-old male who is experiencing weakness and difficulty breathing. The patient has a blood pressure of 84/60, respirations of 18, a pulse of 62, pedal edema, and lung sounds present with crackles/rails. You are most likely treating for. Possible answers include symptomatic bradycardia, cardiogenic shock, hemoglobin deficiency, or emphysema. The correct answer is cardiogenic shock. With the signs and symptoms described, your treatment is most likely for cardiogenic shock. You would not attempt saline boluses due to the lungs already filled with fluids. Next question. A patient reports a tearing pain in his lower back that started an hour ago and has steadily gotten worse. You suspect. Possible answers include organ damage, probably to the spleen, organ damage, probably to the gallbladder, damage to the lumbar spine, or an abdominal aortic aneurysm, or AAA. The correct answer is abdominal aortic aneurysm. A AAA is the only condition that causes a tearing sensation. It is usually felt in the lower back because portions of the aorta are behind the peritoneum. Next question. In normal sinus rhythm, the PR interval must fall between. Options include 0.12 to 0.20 seconds, 0.08 to 0.22 seconds, 0.20 seconds to 0.60 seconds, or 0.04 to 0.06 seconds. The correct answer is 0.12 to 0.20 seconds. The normal PR interval is 0.12 to 0.20 seconds. Next question. Cardiac output is the product of stroke volume and heart rate. Adults have the ability to increase their stroke volume. Pediatric patients do not have this ability. In order to maintain cardiac output, pediatric patients must depend on which of the following? Options include preload, stroke volume, contractility, or heart rate. The correct answer is heart rate. Pediatric patients rely on their heart rate to maintain cardiac output. Contractility and preload are components of stroke volume, which cannot be changed in pediatric patients. Next question. You are on scene at the local health club with a 42-year-old accountant who was working out after work. Bystanders report that the patient had been running on the treadmill for an hour when he passed out and hit his head as he fell off the treadmill. The patient has a weak, rapid pulse and has hot, dry skin. A manual blood pressure reads 70 over palp. What components of stroke volume is most likely the cause of the patient's condition? Options include decreased afterload, cardiac output, contractility, or decreased preload. The correct answer is decreased preload. Preload is the amount of returning blood that puts pressure against the walls of the ventricles just before they contract. Factors that affect preload are circulating blood volume, volume of blood returning to the heart, and strength of atrial contraction. The patient is dehydrated and hypotensive. This should clue you into a problem with preload. Next question. Which of the following conditions is most often responsible for diminishing blood flow to the myocardium? Options include angina, aortic spasm, pulmonary emboli, or atherosclerosis. The correct answer is atherosclerosis. Atherosclerosis is a condition where plaque builds up on the vessel wall and constricts blood flow. Next question. Which of the following are common complications of right-sided heart failure? Select the 3 correct answers. Options include pulmonary edema, liver damage, peripheral edema, decreased cardiac output, or increased preload. The 3 correct answers are liver damage, peripheral edema, and decreased cardiac output. Right-sided heart failure impairs the heart's ability to move blood through the heart, thereby decreasing preload and cardiac output. This in turn results in venous blood pooling, which can cause peripheral edema, often in ankles, legs, and lower back, and liver damage. Pulmonary edema typically develops in left-sided heart failure as blood backs up in pulmonary circulation. Next question. Which of the following rhythms is characterized by the complete dissociation of the conduction pathway at the AV node, resulting in separate atrial and ventricular rates? Options include third-degree heart block, first-degree heart block, second-degree heart block type 1, or second-degree heart block type 2. The correct answer is third-degree heart block. A third-degree block is a complete dissociation of the conduction pathway between the atrium and ventricles at the AV node. A first-degree block is slowed conduction through the AV node. A second-degree type 1 is due to AV node fatigue, and a second-degree type 2 is due to failure of the His-Purkinje system to conduct. Next question. You respond to a 71-year-old male who is having difficulty breathing. He has a history of COPD and tells you this feels exactly like COPD exacerbations he has had in the past. You notice he has rapid/shallow respirations with wheezing throughout upon auscultation of lung sounds. Heart rate is 130 and regular. Blood pressure is 150/88, and SpO2 is 87%, while on his baseline supplemental oxygen of 2 liters per minute. Which of the following is the primary cause of these symptoms during a COPD exacerbation? Possible answers include increased capillary diffusion, VQ mismatch, decreased surfactant, or hypertension. The correct answer is VQ mismatch. In most cases, VQ mismatch is a patient suffering from a COPD exacerbation secondary to restricted airflow. This means the V of the VQ ratio is lower than normal, and the value is lower than normal. Next question. An end-tidal CO2 reading of 50 millimeters of mercury signifies which of the following conditions? Possible answers include hypoventilation, hypoxemia, hyperventilation, or normal ventilation. The correct answer is hypoventilation. A normal end-tidal CO2 reading is between 35 to 45 millimeters of mercury. If the reading is high, it means that the patient is retaining CO2. When we hypoventilate, we lose that ability to blow off CO2 and maintain that ideal range. Next question. You arrive on scene at the local high school football practice to find an unconscious 15-year-old male. The patient's coach tells you that the patient has an inhaler, but told the coach that he lost it earlier in the day. You know that this patient suffers from. Possible answers include alveolar collapse, tracheal deviation, bronchodilation, or bronchoconstriction. The correct answer is bronchoconstriction. Most inhalers are filled with albuterol, a beta agonist responsible for bronchodilation. Conditions like asthma cause constriction, requiring the use of inhalers. Next question. You are dispatched to a patient experiencing respiratory distress. On arrival, you note a thin, 39-year-old female breathing at 23 times per minute. She states she has the chills, and your partner reports a temperature of 102 degrees Fahrenheit. You hear crackles in the right lower field of her chest. You suspect this patient is suffering from. Possible answers include emphysema, pneumonia, croup, or pulmonary embolism. The correct answer is pneumonia. A thin patient with rapid breathing and crackles in the lungs is indicative of pneumonia. Often these patients will have a pink appearance and often complain of shaking, chills, and fever. Next question. You are dispatched emergent to a call for difficulty breathing. Your patient is a 25-year-old female that has no medical history and no allergies. Her only medication is birth control. Breath sounds are normal, but she is showing signs of JVD. Vitals are within normal limits, leading you to suspect. Possible answers include pericardial tamponade, pulmonary embolism, atherosclerosis, or hemothorax. The correct answer is pulmonary embolism. Young women on birth control are susceptible to blood clots, which can lead to a pulmonary embolism. Next question. You are suctioning blood from a patient's mouth when you accidentally stick the suction catheter too far into the mouth. This stimulates a gag reflex, producing additional vomitus and blood into the airway. Your first step should be: options include remove the catheter and roll patient to one side, turn the suction up and suction for an additional 10 seconds, assume the need for an advanced airway, or move away from the patient as they vomit. The correct answer is remove the catheter and roll patient to one side. One of the fundamental rules of suctioning the mouth is to watch the tip and ensure you do not stick the catheter too far into the airway. When a gag reflex is stimulated, it is important to immediately remove the suction catheter and roll the patient to his or her side to prevent a backflow of vomitus and blood into the airway. Next question. Your patient is a 16-year-old female who was found unresponsive in her bedroom. Her parents state that she was last seen about an hour ago, coming home from her friend's house. Upon assessment, the patient has snoring respirations and is breathing 6 times per minute. Her SpO2 is 72%, her pulse is 140 beats per minute, and her blood pressure is 100/50. Which of the following should be completed first? Options include: insert an NPA and begin ventilating the patient with a BVM, insert an OPA and begin ventilating the patient with a BVM, insert an NPA and place the patient on oxygen at 15 liters per minute via non-rebreather, or reposition the patient's airway. The correct answer is reposition the patient's airway. The patient presents with snoring respirations, most likely caused by obstruction from the tongue sliding back and occluding the airway. The first thing should be to reposition the airway with a head tilt chin lift or jaw thrust maneuver, and then attempt to ventilate the patient with a BVM. Next question. You are treating a patient who is wheezing secondary to an asthma attack. Which part of the lung is constricted, resulting in wheezing? Options include bronchioles, trachea, pleura, or none are correct. The correct answer is bronchioles. The bronchioles are the smaller airway passages in your lungs. At the ends of the bronchioles are the alveoli. When these passageways constrict, it becomes more difficult for air to reach the alveoli, making gas exchange difficult, resulting in respiratory distress. Next question. Which phase of a capnography waveform represents inhalation? Options include phase 1 baseline, phase 2 ascent, phase 3 plateau, or phase 0 descent. The correct answer is phase 1 baseline. During inhalation, there is no CO2 leaving the body, and therefore the waveform is flat. This is known as the baseline and is phase 1. Phase 2 marks the beginning of inhalation and is represented by a sharp rise in the graph. Phase 3, the alveolar plateau, represents a steady flow of CO2 from the lungs into the atmosphere. Finally, phase 0 is a quick drop-off as the patient stops exhaling and transitions back to inhalation. Full inhalation is marked by phase 1, where the waveform moves along its baseline. The correct answer is phase 1 baseline. During inhalation, there is no CO2 leaving the body, and therefore the waveform is flat. This is known as the baseline and is phase 1. Phase 2 marks the beginning of exhalation and is represented by a sharp rise in the graph. Phase 3, the alveolar plateau, represents a steady flow of CO2 from the lungs into the atmosphere. Finally, phase 0 is a quick drop-off as the patient stops exhaling and transitions back to inhalation. Full inhalation is marked by phase 1, where the waveform moves along its baseline. Next question. You are assessing a patient and notice a full bottle of furosemide on the nightstand table. When you pick it up, you see that it was filled over a month ago, but when questioned, the patient tells you that she doesn't take it because it makes her urinate too much. Based on what you know, which of the following is likely the reason the patient is prescribed this medication? Options include hypertension, kidney failure, chronic urinary tract infection, or pulmonary edema. The correct answer is pulmonary edema. Furosemide is also known as Lasix and is often prescribed for patients that suffer from pulmonary edema or other fluid retention disorders. Next question. You are dispatched to a 53-year-old female with altered mental status. She is in and out of consciousness. The patient's vitals are a blood pressure of 108/67, a heart rate of 102, SpO2 of 95%, respirations of 18, and a CBG of 22. You were unsuccessful in 2 IV attempts and your partner is not confident that they would succeed. What is the next appropriate course of action? Options include administer glucagon, administer O2 via nasal cannula, administer oral glucose, or have your partner make at least 1 IV attempt. The correct answer is administer glucagon. First, let's eliminate 2 of the answers. This patient has a CBG of 22, and being unconscious is a contraindication of oral glucose. O2 is indicated in patients with a saturation of less than 94%, and based on the information you have, they do not have respiratory distress. Now we're down to 2 answers. IV access would be very beneficial. IV access would be really beneficial, but the likelihood of success is low enough that we should look to other options. Glucagon is indicated with hypoglycemia and the inability to obtain IV access. The dose is 1 milligram intramuscularly. Next question. Your patient is an 82-year-old male who's experiencing septic shock. Which stage would he most likely be in with the following vital signs? Heart rate of 158, blood pressure of 68/28, SpO2 of 92% on room air, and a respiratory rate of 28 per minute. Options include irreversible shock, compensated shock, decompensated shock, or death. The correct answer is decompensated shock. The presence of tachycardia with severe hypotension, a MAP of 41 millimeters of mercury, indicates that the cardiovascular system is no longer able to compensate and maintain a normal blood pressure or MAP. Next question. Deficiency of what substance is the cause of Wernicke's encephalopathy? Options include iron, folate, riboflavin, or thiamine. The correct answer is thiamine. Thiamine, or vitamin B1, is essential to energy production in the body. If there is a deficiency, it results in loss of energy, which causes cellular injury. Next question. Deficiency of what substance is the cause of Wernicke's encephalopathy? Options include thiamine, iron, folate, or riboflavin. The correct answer is thiamine. Thiamine, or vitamin B1, is essential to energy production in the body. If there is a deficiency, it results in loss of energy, which causes cellular injury. Next question. Shoulder dystocia is the result of a fetus's shoulder getting stuck on which anatomical feature? Options include mother's pelvic bone, mother's spine, umbilical cord, or mother's vaginal canal. The correct answer is mother's pelvic bone. The infant's shoulder is getting caught on the mother's pelvic bone. Certain maneuvers can help to try and free the shoulder so the infant can be delivered. Try placing the mother in the knee-chest position. Next question. You are caring for a patient who reports that she is pregnant for the 4th time. She has had 2 live births and 1 miscarriage. How would this patient be expressed? Options include gravida 4, para 2, gravida 5, para 2, para 3, gravida 4, or para 3, gravida 2. The correct answer is gravida 4, para 2. Gravida indicates how many times the patient has been pregnant, regardless if the baby was carried to term. The current pregnancy is included in this count. Para indicates how many viable births the patient has had. Next question. You are called to the report of a 53-year-old man who was stung by a bee. He is alert and oriented, though anxious on your arrival and growing increasingly lethargic. He has hives on his chest, lung sounds are clear, breathing unlabored, with an SpO2 of 93%. The manual blood pressure comes back at 82/58. Which of the following is the most appropriate action? Options include Benadryl 50 mg PO, start peripheral IV and administer epinephrine 1 to 10,000 at 0.1 mg, oxygen at 2 liters per minute, or IM epinephrine 1 to 1,000 at 0.5 mg. The correct answer is IM epinephrine 1 to 1,000 at 0.5 mg. This patient is demonstrating signs of distributive shock secondary to anaphylaxis. The patient needs immediate epinephrine administration to avoid cardiac arrest. Next question. A patient that is burning fat as a source of energy instead of glucose might be experiencing which of the following? Options include DKA, insulin shock, HHNS, or seizures. The correct answer is DKA. Diabetic ketoacidosis, or DKA, occurs when fat is being burned as a source of fuel instead of glucose. The waste product of this are ketones. Ketones can produce a fruity smell to the breath. Typically, these patients will have high blood sugar, but are unable to use it for energy because of a lack of insulin or resistance to insulin. Next question. You are treating a patient for hypoglycemia who is conscious, alert, and oriented ×4 and able to protect his own airway. Which 2 of the following would be the most appropriate treatments for this patient? Options include dextrose, glucagon, orange juice, or oral glucose. The 2 correct answers are oral glucose and orange juice. Treatments for any patient should always begin with the least invasive and move to more invasive as necessary. For a hypoglycemic patient who is alert and oriented and able to follow commands and is protecting his own airway, an oral form of sugar would be the best initial treatment. Next question. Which of the following is a common cause of chronic kidney disease? Options include chronic hypotension, chronic hypertension, untreated arrhythmias, or angina. The correct answer is chronic hypertension. Hypertension and diabetes mellitus are responsible for many cases of chronic kidney disease / end-stage kidney disease. Next question. Cholinergic toxicity may be caused by all of the following except options include mushrooms, sarin, organophosphates, or calcium chloride. The correct answer is calcium chloride. Cholinergic toxicity can be caused by various sources, including mushrooms, nerve gas agents like sarin, organophosphates, and carbamate insecticides, and some medications. However, while excess calcium can undoubtedly interfere with muscular function throughout the body and cause fatigue and GI upset, the other specific symptoms of cholinergic toxicity, think sludge or dumbbells, are inconsistent with excessive calcium chloride. Next question. You are treating a patient who has burns to both legs from gasoline catching fire underneath them. You expose the area and note blisters to the skin and a very wet appearance. What type of burn did this patient most likely experience? Options include partial thickness, superficial, full thickness, or first degree. The correct answer is partial thickness. A partial thickness burn is also known as a second degree burn. It involves the epidermis and parts of the underlying dermis layer. They're very painful and have blisters and a wet appearance due to the escaping fluids. Next question. After staging your ambulance, police determine that it's safe to enter the scene. You arrive to find a 19-year-old male with a gunshot wound to the chest. How should this patient be treated? Options include occlusive dressing over the wound, sterile gauze and direct pressure, high flow oxygen and rapid transport, or chest decompression. The correct answer is occlusive dressing over the wound. When a hole is created in the chest, air can enter into the pleural space. If left untreated, this can develop into a tension pneumothorax. Our goal by placing an occlusive dressing is to allow air to move out of the space, but not go in. Next question. A patient experiencing diaphragmatic rupture will present with signs and symptoms that are very similar to which of the following conditions? Options include tension pneumothorax, acute myocardial infarction, abdominal aortic aneurysm, or ruptured esophagus. The correct answer is tension pneumothorax. Diaphragmatic ruptures will present with dyspnea, hypoxia, JVD, and hypotension. These are all signs and symptoms one would see in a patient with a tension pneumothorax. Next question. Which type of splint requires the use of manual traction? Options include bipolar, tripolar, monopolar, or unipolar. The correct answer is bipolar. Bipolar splints refer to those that use two rods to hold traction on the femur. These require manual traction to properly align the injury initially. Next question. A 34-year-old female has fallen on her outstretched hand, resulting in pain and deformity to her elbow. Which pulse point would be most appropriate to assess distal to the injury? Options include brachial, radial, pedal, or ulnar. The correct answer is radial. You are assessing the pulse distal to the injury, which means further away from the point of reference. As EMTs, we do not assess the ulnar pulse. The brachial pulse is proximal to this injury. Next question. Which major solid organ in the left upper quadrant is most often injured in traumas? Options include bladder, gallbladder, spleen, or liver. The correct answer is spleen. The liver and gallbladder are both located in the right upper quadrant. The urinary bladder is hollow and is located at the division of the right lower quadrant and left lower quadrant. Next question. Which of the following autonomic responses help the body accommodate small amounts of blood loss? Options include increased perfusion to the skin, shunting of blood away from vital organs, dilation of the blood vessels, or increased heart rate. The correct answer is increased heart rate. The body is able to accommodate small amounts of blood loss. It does so by contracting the muscles within the vessel walls to decrease the volume blood must fill. The heart rate increases to keep blood circulating so it can maintain adequate perfusion. Blood is diverted from the non-essential organs to ensure that the vital organs have enough circulation to maintain function. Next question. You are called to the scene of a rock climbing wall. Your patient is a 22-year-old female with trauma to her lower leg. The injury appears to be a large flap of skin and tissue hanging off her leg that occurred when her foot slipped while climbing. This injury can be described as. Options include a laceration, an avulsion, an abrasion, or a contusion. The correct answer is an avulsion. An avulsion is most commonly described as a flap of skin or tissue still attached to the body. A contusion is a closed wound like a bruise. An abrasion is usually superficial and appears as a scrape across the skin. A laceration is a cut that extends through multiple layers of skin and subcutaneous tissue. Next question. Next question. You are at the scene of a motorcycle accident. Your patient is lying on the ground with obvious signs of trauma. He has fluids leaking from his nose and ears, presumably cerebrospinal fluid. How do you treat the leaking CSF? Options include clean the fluid away but apply no pressure, apply direct pressure to ears and nose, use gauze to pack the ears and nose to stop the flow of CSF, or CSF is normal after any trauma, continue assessment and transport. The correct answer is clean the fluid away but apply no pressure. When you find CSF, you should suspect cranial fractures and possible brain damage. You can clean away the fluid, but make sure that you do not place pressure on the skull. A finding of leaking CSF from the nose or ears should be cause for immediate transport. Next question. You arrive on the scene of an automobile versus pedestrian accident. A male patient who appears to be in his 20s is down in the middle of the road. On initial assessment, you note a blood pressure of 92/66, pulse of 135, respiratory rate of 30, and he is briefly opening his eyes when you call his name. You believe this patient is experiencing which of the following? Options include shock, increased intracranial pressure, pneumothorax, or stroke. The correct answer is shock. This patient has low blood pressure, high pulse, high respiratory rate, and altered mental status. The decrease in blood pressure signals that this patient is entering decompensated shock. Increased intracranial pressure, or ICP, is often associated with widened pulse pressure, bradycardia, and irregular respiration. Next question. 911 calls indicate that there are at least 25 patients in a college campus shooting. SWAT teams are engaged in a heavy firefight with 2 gunmen in one of the residence halls. What type of incident is this? Options include contained, explosive, evacuated, or active. The correct answer is active. An active incident is one in which the events that led to the mass casualty incident are still present, such as fire, weather, or shooter at large. Next question. Which of the following does not need to be insured for safety purposes before assessing a vehicle that has power lines on top of it and smoke coming from the engine compartment? Options include starring of the windshield, containment/extinguishment of fire, stabilization of the vehicle, or power lines are not live as power has been turned off and verified by a power company employee. The correct answer is starring of the windshield. Although starring of the windshield may help determine the severity of a crash and give you an idea of what type of forces a patient was subjected to, starring of the windshield is the least of your worries in this situation. You must ensure the power is off, the fire is out or contained, and the vehicle has been properly stabilized before attempting to access the patient. Next question. You are responding with lights and sirens on a 3-lane highway that has a middle lane for traffic to make turns into businesses along the route. One of the vehicles along the route makes a sudden turn into the middle turn-only lane before you make your way by. How should you proceed? Options include stop and wait for the vehicle to pull to the right, pull around the vehicle to the left on the other side of the highway, pull close behind the vehicle until it moves completely to the right, or pass the vehicle on the right and continue on. The correct answer is stop and wait for the vehicle to pull to the right. Always pass all vehicles to the left in the safest manner possible. Pulling onto the other side of the highway will compromise a safe distance on all sides. The correct way to proceed is allowing the vehicle to pull to the right and then proceeding by. Next question. When parking your emergency vehicle to block oncoming traffic at the scene of a crash, how should you park your apparatus? Options include at a 45-degree angle to traffic, taking up multiple lanes, park in the center median, perpendicular to traffic, taking up multiple lanes, or parallel to traffic, taking up one lane. The correct answer is park at a 45-degree angle to traffic, taking up multiple lanes. Park at a 45-degree angle to deflect traffic away from the incident if a vehicle does hit the emergency apparatus. If you need to shut down all lanes of the road, don't hesitate to do so. Your safety and the safety of all personnel at the scene is more important than keeping a road open for travel. Next question. A family physician called 911 to have one of her patients transported to the ER, whom she believes to have suffered a minor stroke. You arrive to find the patient, a 78-year-old man who is conscious and alert, refusing to take an ambulance to the hospital. How should you proceed? Options include call one of the patient's family members and ask permission to transport, go back to your ambulance and return to quarters, determine the patient's level of competency and request the patient sign a refusal of transport form, or transport the patient because the physician requested it. The correct answer is determine the patient's level of competency and request the patient sign a refusal of transport form. If you have a patient who is alert and oriented, it is illegal for you to take them to the hospital against their will. After you have determined their level of competency, ask the patient to sign your refusal form. This is a tough call, but you must follow the law. It would be entirely appropriate to call family and attempt to get them to explain to the patient why they should be transported, but ultimately it is not their decision to make. Also, don't assume anyone has power of attorney unless the question specifies it. Next question. You are assisting a 23-year-old male who told his family he doesn't want to live anymore and has a plan to kill himself. There is no evidence of drugs/alcohol. The patient seems to be properly oriented, and he's acting friendly towards responders. Under what circumstances can this patient sign a refusal? Options include: he can't sign a refusal and needs to be transported for further evaluation, if he is conscious, alert, and oriented properly, if the patient tells you that he didn't actually mean what he said, or if he will be transported to the hospital by a family member or close friend. The correct answer is he cannot sign a refusal and needs to be transported for further evaluation. This person needs to be evaluated by a doctor, and you are not able to leave him or allow transport by family/friends. By making these threats, there is sufficient evidence that he is a threat to himself. If the patient is adamant about not being transported, use all resources you have available, such as police, online medical control, or mental health professionals, but he must be seen by a doctor. Next question. You are on scene of a patient being extricated from his vehicle after a rollover accident. Your goal as the transporting unit is a scene time of 10 minutes or less, but it has already been 20 minutes and the patient is in and out of consciousness. As you stand by waiting to receive the patient for transport, what should be considered? Options include aeromedical transport if the transport time would be reduced, vehicle stabilization, using a KED or emergency lift to speed up the removal of the patient from the vehicle, or calling in additional units for the extrication. The correct answer is aeromedical transport if the transport time would be reduced. This is a tough one because all of the answers are considerations that could change the outcome for this patient. From the information given, you are not involved in the extrication, but are standing by as the transporting unit. Vehicle stabilization and additional personnel should be the responsibility of command. There are many factors involved, but if aeromedical transport will reduce the time to the hospital, usually by 10 minutes, then it should be considered. Next question. You are en route to an unconscious female at a residence 2 blocks from your station. The dispatch information is scratchy, and you hear something regarding an irate female at the residence. Which of the following actions should you implement when you arrive on the scene? Options include stage outside the house until police arrive, do a 360 around the house to look and listen in order to gather as much information as possible, knock loudly at the door announcing your presence, then direct everyone inside to come out to the ambulance, or try to make contact with the victim without anyone else on scene noticing. The correct answer is stage outside the house until police arrive. Scene safety is the utmost priority when running calls. If you are ever unsure of what the dispatcher is trying to tell you, stage yourself somewhere safe until you can get the picture they are trying to paint you. By allowing police in first, you can more efficiently do your job safely. Next question. You're responding to an MCI at a multiple crash pileup. When you and your partner arrive on scene, you are ordered to begin triaging patients immediately. The person that gave you this order is most likely the options include liaison officer, safety officer, incident commander, or public information officer. The correct answer is incident commander. The incident commander oversees and manages all resources regarding an MCI. Last question. You arrive at a local church to treat several cases of nausea, lightheadedness, and weakness from both community and staff members. These symptoms range from minor in young to middle-aged patients to more moderate in elderly patients. All have the same time of onset. Your primary concern is: options include checking the scene for a potential hazmat concern, assessing respiratory status of patients starting with those experiencing the most severe symptoms, immediately begin triaging patients, or obtain baseline vitals immediately so you can track any changes in your patients. The correct answer is checking the scene for a potential hazmat concern. When there are multiple victims and no apparent cause, think hazmat. There's likely a root cause of the common symptoms somewhere in the scene. Your safety always comes first prior to treating any patient.
Thanks for tuning in to EMTprep Pulse Check. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with your classmates and crew. For more test prep tools, study guides, and practice exams, head over to emtprep.com. Until next time, stay sharp, stay safe, and stay on pulse.